As CEO of St. Francis Healthcare System of Hawaii, Sister Agnelle Ching shifted the organization's emphasis from inpatient care to community wellness and healthy living through care of the whole person, body, mind, and spirit. An innovator committed to meeting the needs of all, Sister Agnelle led the creation of the St. Francis Healthy Lifestyles program, bringing nurses and health education to schools, parishes, and public forums. Recognizing the needs of Hawaii's growing senior population, she was responsible for the development of the Franciscan Villas, the first affordable independent living community, providing senior housing with supplemental health services. Under her leadership, St. Francis Home Care Services introduced the first telehealth monitors in use on the island, enabling many people to stay in their homes and manage their medical conditions. And the Stay Healthy at Home program, which she initiated and nurtured, is enabling Hawaii's elderly to live independently through a network of care coordination and access to supportive services like health screening and education, spiritual support, transportation, meals, caregiver respite, and more. To meet the needs of those with chronic and life-threatening illness, she led the launch of her system's palliative care specialty, and to better care for those at end of life, she supervised the modernization of 2 hospice centers. Through her leadership and well-executed vision, St. Francis Healthcare System has extended its long-standing tradition of meeting the greatest needs of the island population. In quiet and unsung ways, she lives out a mission of caring for all Hawaii's people, regardless of race, color, or creed. Sister Agnelle believes in a legacy of caring based on a simple premise. Wherever the needs are, that's where we want to be. We follow our hearts as God leads us to bring joy and peace to others.
Being fearless is part of being a leader in this day and age. It would be very difficult to stay in healthcare if you were not fearless, if you were not a risky person, because it is highly unpredictable as to where healthcare, especially in our country, is really heading. How do we keep our healthcare system moving well into the future? As many things are happening in this day and age, in particular, that concept of always trying to balance mission and margin in some fashion, that gets more and more challenging. And the margin part, I believe, is getting much more challenging than it ever has been. At one time, I believe we used to make 5-year plans. I think now we're down to 3-year plans, and possibly in the future, even shorter time frames. As a leader, I would like to be known that I have carried out the mission at a very high level, and that we are able to walk the talk. The words that we say must be modeled in how we act and the things that we actually do. People say I am a visionary, and I like to believe that I am doing what I should be doing. I am a strong believer in that God has asked me to be here, that I tell all our new employees that they are called to really work at St. Francis. They don't just happen to come for the job opening. And I believe for me that is the same thing, that I have been called to come here at this time and to be sure that the healthcare system can move well into the future so that we can continue to help other people. I believe that I have come full circle. I grew up here in the islands. I worked on the East Coast for approximately 30 years, and now I'm back, and I'm very happy to be here.